The hospital's a hospital, right? It's not a place, it's not a residence, right? People go there to get better and they leave, right? You know, it shouldn't be her place to live. She only has no clothing or nothing there, just shoes and sweater, and she has a gown, and that's how she lives.
That was Elizabeth Rinka's life for months. She landed in hospital in March after what her son calls a mental health episode. It wasn't the first time.
We figured that she would, be reassessed, maybe some medications altered a bit, and she would be fine to go back to, the care facility. This is what we were led to believe.
2 weeks later, doctors said Elizabeth Rinka was well enough to leave hospital, but she had nowhere to go.
We get a call from the care home and saying that they closed her bed, basically kicked her out at the 11th hour. So, and now she's been warehoused in the hospital there.
Norm Rinka says hospital staff didn't know how to deal with his mother's psychological problems. And the longer she stayed, the more agitated she became. She'd end up spending hours restrained and medicated in her bed. One study found patients admitted to general hospitals for mental illness are 76% more likely to be restrained than those in a psychiatric hospital. Health officials in this case say restraints were used as a last resort. Norm Rinka says it was only after Go Public contacted health officials that the hospital told him they may have a solution. His mom was recently moved to a facility that meets all of her needs. Hospital officials tell us they were waiting for her health issues to stabilize. Seniors advocates say situations like this are plaguing the medical system across the country. Rosa Marcatelli, CBC News, Calgary.